Hello everyone. We, Edwin Ikni and Nidisha Raj, we are here to present our research topic, Closing the Gap Health Policy of Indigenous Australians. What is Closing the Gap Health Policy? Actually, there is a gap between Indigenous Australians and non-Indigenous Australians for the achievement of key indicators. And this Closing the Gap policy is to tackle these issues. And our research question is, to what extent do the Closing the Gap policy addresses the health inequalities of Aboriginal Australians? I already mentioned about the comparison between the Aboriginal Australians and the other Australians, and these health inequalities are a worldwide issue. And by understanding the major causes of these inequalities in health, it's critical to seek a long term solution to the issues that have been documented. According to the report of World Health Organization in 2008, policymakers must address health inequalities within the population by drafting policies that include social justice element. This would ensure that the marginalized people in the community have equal access to basic facilities of life and are given the opportunities to participate in civil society. And due to these inequalities between this community, all the states in Australia drafted closing the gap policy to address indigenous disadvantages. And as a result of this, we made our goal of our research to undertake a thorough analysis of the various policies aimed at closing the gap and determining the degree to which they have succeeded in resolving indigenous disadvantages. Moving to the next topic, research design. In this qualitative research report, the policy analysis approach was used to perform a critique of Indigenous Australians closing the gap policy. The policy analysis is useful in understanding why policies are enacted, as well as serving as a research method for determining the importance of research evidence in the policy formulation. This approach also facilitates successful policy document advocacy, which can have a beneficial impact on a population health. Data collection method was like we gathered in the form of text and numbers from appropriate relevant policy documents on closing the gap health policy. And also we went through national, state and local government website across Australia, and a quick search of policies on closing the gap policy for Indigenous Australians was also conducted. And these policies were chosen like if the policy's title refers to Aboriginal health in Australia. A total of 11 policies that met the inclusion criteria were selected at last. Moving to the data analysis, we used coding pattern for analysis of closing the gap health policy, and at last it resulted into 5 coding options, and it were categorized. Every code corresponds to one of the policy document's health objectives. The risk of disclosure was also coded and defined in the text. A narrative report was written for each code in the key categories and then joined to present the results in order to ensure consistency in the interpretation of the work. And this was our code recording form. Ethical considerations. In order to conduct a research study in Australia, the researchers must adhere to certain values including justice, beneficence, human respect, and research merit and honesty. And our work considered the research merit and honesty because of the nature of our study, which is policy analysis. Our study will assist the government in developing more effective policies for Aboriginal Australians, thus enhancing the indigenous population's overall well-being. This research was conducted out by professionals with medical degrees, and the study was carried out in a professional manner. And I'm welcoming Edwin Ekney to present the results and the rest of the topics.
Good day, my name is Edwin. I'm going to continue from where my colleague stopped. So, speaking on the results we got from analysis of 11 closing the gap health policies of Australian government. So we have table 3 that illustrates an overview of the 11 policy documents we got from various Australian websites. For the very first one, the previous table 2, highlighted the numbers of the policies and the policy title. So we categorize it into the policy documents, the number, the major health issue discussed in the policy. We also looked at the aim of the goal. We try to acknowledge and audit evidence to know its extent in addressing the issues of social determinants of health of Aboriginal Australians. We also consider the social gradients, the differences in health status due to economic differences as well, the objective strategies, the strategies main code. We have a look at some of the health risks that predispose people of Aboriginal Australians to disease condition, and the strategies to address the issues of inequalities were also looked. The last one covered the main social determinants of health that were observed in the policy document. So overall, the major health issues talked about in the policy document are issues related to child and maternal health, and also chronic diseases, such as cardiovascular diseases. Also, issues on mental health were also talked or discussed by some of the policy documents. And looking at the aim of the selected policy document, we find out that 80% of the policies are actually based on the population in a way of closing the gap in health inequalities and social determinants of health the Aboriginal between the Aboriginal Australians and the non-Indigenous Australians. We also looked at from the table the objective, and most times the objective basically is to improve health and well-being, to promote the health of Indigenous Australians, to provide a conducive environment where these persons feel belong to the society, and also to respect their cultures as well. So the strategies basically to close this gap in inequalities are based on prevention, um, promotion of good health practices, taking care of the well-being of the Aboriginal Australians, and also provision of quality healthcare services. So we had a discourse on some of the health risks that we identified from the policy documents, such as suicide, physical inactivity, obesity, and illicit use of drugs. So these are all captured in the results table from the results section. So from the discussion point, we found out that the analysis of the selected 11 policy documents of closing the gap policies shows that the Australian government is addressing to a greater extent health related issues of concern of Indigenous Australians, and to a lesser extent the social determinant of health of the Aboriginal people of Australia. From our analysis, we observed that 90% of the policy document actually showed plans and strategies, uh, and these are focusing mainly on health promotion, well-being, good governance, and improvement in the health workforce for the Aboriginal Australians. And also, 60% of the policy document show or pointed out 7 priority areas, you know, uh, consisting mainly tackling of smoking, provision of primary healthcare services that can deliver, and all this we are coded in our policy document. In conclusion, we'll say that the numerous policy documents used in the study indicate that Australian government actually prioritize at the moment the health of indigenous Australians, coming up with policies to bridge the gap in health inequalities and social determinant of health of Aboriginal people of Australia. So from the review of the policy document, we discovered 108 strategies for improving the health of Indigenous Australians, and with focus on health promotion, well-being, good governance, and why most of the interventions, um, we are basically more of medical model of approach of health prevention. It focused more on provision of quality healthcare services. Only few policy documents actually highlighted or took the approach of social determinant of health. That is why we are recommending that the future policymakers should look holistically into the approach of creating a balance between the biomedical approach, provision of quality healthcare services, and also looking into the social determinants of health approach as a way of closing the gap entirely between the health of Indigenous Australians and the non-Aboriginal Australians. Um, our recommendation, we propose that in closing the gap in social health inequalities or social determinant of health between Aboriginal, the different health should provide broader social determinant of health. So in order to close the gap, it is proposed that future policy makers, broaden the policy to include social determinant of health. Um, Time for questions and comments.